So if the wound is infected,
Right.
it can diagnose that
Yeah.
with a visual indicator and then
Yeah.
deliver, in this case, a therapy, which is going to be an antimicrobial,
Right.
and treat the wound before it gets out of hand.
Hey, Nick, is this salad dressing you brought with us or a different type of dressing?
Hi, Nigel.
Hi.
This is definitely not salad dressing.
Super happy to be here, by the way.
Nice to have you. Yeah, this is a wound dressing that we're looking at here.
Well, it doesn't look like the dressings we have at our house, because all the dressings in our house, all the Band-Aids and stuff, are all Pokemon type Band-Aids.
Right. Yeah, you have some young children.
That's right.
In
Yes.
your home.
It's just not just him, and I do appreciate the
Pleasure.
odd Bulbasaur keeping me safe as well.
Very good. Yeah, and then I'm more of a Charizard.
Yeah, of course you are.
But yes.
Tell your Charizard from a mile away.
So interesting, right? We're having a bit of I would say, an application issue, kind of like with only without Pokemon, something a little bit different. So this dressing is just a representative of a project that we're working on, and that is we're developing a theranostic wound dressing.
Yeah, that's cool. And theranostic, that sounds like a pretty funny word. Is that a real word?
Well, I guess maybe it is, maybe it isn't. It's a combination of words that we're using here. So we have two words. Therapy, thera, and then gnostic, diagnostic.
Yeah, cool. That's cool. And so, is this a dressing that will both diagnose and then actively provide therapy, even though it's
top of the class,
Nigel.
Nigel.
But there's no computer.
Yeah. Well, that we're working on that. Yeah. So exactly right. So the concept with the dressing here is to use it in a setting. Yeah. It's able to detect infection state, right? So if the wound is infected, it can diagnose that with a visual indicator and then deliver, in this case, a therapy, which is going to be an antimicrobial, and treat the wound before it gets out of hand.
Wow, that's cool. And so then there must be some advantages as far as not over-releasing or under-releasing, or just slathering on some polysporin or what have you.
Yeah, that's exactly one of the key concepts. We talk about product development. We're always talking target product profile. What are the advantages? Yeah. So that's one of them, right? Antimicrobial stewardship, and making sure we're not overusing it and doing it when it's correct, or indeed having an intervention at all. So that's one of the concepts, and one of the bigger ones actually that we're running against. And it's interesting you bring up the Pokemon dressing, right? Is where do you use something like this?
Yeah.
Does it make sense for like you and I? We get a minor cut, put it on there. This dressing that we're talking about, it is going to incorporate some electronics. Golly. I don't want to have a box, that's $100,000 worth of dressings in my house.
You've got the anti-child kit, and you've got a lock on it and maybe a chain. And,
exactly. Yeah. So it doesn't really make sense in that application, but it does in the situation of chronic wound care, right? Diabetic foot ulcers, that sort of thing, where the cost of the intervention and the duration of that really makes this a product an appropriate choice.
Well, it's so exciting how smart some things are getting around us, and I hope you guys find a perfect application for it, because it seems like lots of potential.
Yeah, absolutely. Yeah. Well, it's great talking with you, Nigel.
Yeah, great. I'm going to go find some salad.
Sounds good.